In contrast to thyrotoxicosis, which we covered in our prior lecture, let's now look at hypothyroidism. Hypothyroidism refers to a state in which there's insufficient thyroid hormone available to meet the needs of the body. So thinking back on the normal actions of thyroid hormone, let's think how hypothyroidism may clinically manifest. If a patient is hypothyroid, we're going to see a decrease in metabolic activity. These patients may have cool skin, weight gain, a slower heart rate, hypo-reflexia, fatigue, and constipation. When a patient comes to the office with these particular symptoms, hypothyroidism should be one of the diagnoses we consider. These findings are, however, relatively nonspecific, so we must confirm the diagnosis with thyroid function testing. There are various causes of hypothyroidism. One of the most common causes is an autoimmune condition called Hashimoto's thyroiditis. In Hashimoto's thyroiditis, the immune system develops an autoimmune response against components of the thyroid gland and thyroglobulin. Common autoantibodies are directed against thyroid peroxidase and thyroglobulin. The autoimmune response damages thyroid tissue, and over time, progressive thyroid cell injury can reduce the gland's ability to produce thyroid hormone and eventually result in hypothyroidism. Although it is relatively uncommon in iodine-sufficient developed countries, iodine deficiency is another potential cause of hypothyroidism. Remember that iodine is required to synthesize T3 and T4. If there's inadequate iodine available, the thyroid cannot produce adequate amounts of thyroid hormone. Hypothyroidism can also result from treatments that damage or remove thyroid tissue. For example, a patient may undergo surgical removal of part or all of the thyroid gland. Depending on how much functioning thyroid tissue remains, this can result in hypothyroidism. Another example that we would commonly encounter in my medical practice with our head and neck cancer patients is radiation therapy involving the neck. Radiation exposure to the thyroid can damage functioning thyroid tissue and lead to hypothyroidism over time. So these are a few potential causes of primary hypothyroidism. When we use the term primary hypothyroidism, it means that the thyroid gland itself is the problem. Now let's look back at our regulation of thyroid hormone. If T3 and T4 decrease because the thyroid gland is failing, we remove the negative feedback on the anterior pituitary. As a result, TSH secretion increases. Therefore, the classic laboratory pattern in primary hypothyroidism is decreased thyroid hormone with an elevated TSH. This elevated TSH can also have trophic effects on the thyroid tissue. If functioning thyroid tissue remains and is chronically stimulated by TSH, the gland may enlarge and form a goiter. Iodine deficiency is a good example. The thyroid does not have enough iodine to produce adequate thyroid hormone. T3, T4 decreases, negative feedback decreases, and TSH increases. The elevated TSH chronically stimulates the thyroid gland, which can produce goiter. Now, Hashimoto's thyroiditis can be associated with goiter as well, particularly in the earlier stages of the disease when there's still some residual functioning thyroid tissue. As the autoimmune damage progresses over time, however, the gland eventually becomes fibrotic and decreases in size, a process called atrophy. If the thyroid's been completely removed, as in surgical cases, then obviously there's no thyroid tissue remaining on which TSH can exert its trophic effect. As I mentioned, these are all causes of primary hypothyroidism. There are also less common causes of hypothyroidism that involve the pituitary gland or the hypothalamus. These are referred to collectively as central hypothyroidism. In that situation, TSH is not appropriately increased despite inadequate thyroid hormone levels. We're not going to focus on those disorders in this class, but it's important to recognize that the statement hypothyroidism is caused by an elevated TSH specifically applies to primary hypothyroidism. A final word on goiter. Goiter simply means enlargement of the thyroid gland. It does not tell us whether the thyroid gland is functioning normally or producing too much hormone or producing too little hormone. We saw in Graves' disease that patients can have hyperthyroidism and a goiter. We saw with iodine deficiency that patients can have hypothyroidism and a goiter. And we can even see patients who have completely normal thyroid function and still have an enlarged thyroid gland. So goiter does not indicate thyroid function, it simply describes an enlarged thyroid gland. There are several mechanisms that can cause the thyroid to enlarge. One important mechanism is chronic stimulation of thyroid growth. In iodine deficiency, for example, an elevated TSH provides that trophic stimulus. In Graves' disease, TSH receptor autoantibodies stimulate the same receptor and can also cause thyroid enlargement. Other conditions, including nodular thyroid disease, can produce enlargement through different mechanisms. There are also substances that we refer to as goiterogens. These are substances that can interfere with the normal thyroid hormone production or thyroid function, and under appropriate circumstances may contribute to thyroid enlargement. Certain medications can have this effect. One is lithium, which is used to treat some psychiatric illnesses. Dietary substances can also have goiterogenic effects. Although for most people consuming a normal diet with adequate iodine, this is not a reason to avoid these foods. Finally, this is a young woman who came to see me in my office several years ago. You can see she has a very thick appearing neck, and this enlargement is due to a thyroid goiter. Her thyroid was markedly enlarged, yet she was euthyroid, meaning she had normal thyroid function. Here I've superimposed what a normal-sized thyroid would look like. After surgically resecting her thyroid, this was the size of her thyroid. This is a useful example because it reinforces an important concept from our thyroid lectures. The size of the thyroid gland and the function of the thyroid gland are two different things. A patient with goiter may be hyperthyroid, hypothyroid, or euthyroid.